Welcome back, dear students. Today we are going to be talking about endocrine system. We're gonna examine thyroid glands, parathyroid glands, pancreas, and gonads. We'll examine different types of glands and their hormones. First of all, about thyroid gland. The thyroid gland is made up of two lobes connected by a narrow band called the isthmus. The lobes are located on each side of the trachea, just inferior to the larynx. The thyroid gland is one of the largest endocrine glands. It appears more red than the surrounding tissues because it's highly vascular. It's surrounded by a connective tissue capsule. The main function of the thyroid gland is to secrete thyroid hormones, which bind to nuclear receptors in cells and regulates the rate of metabolism in the body. Is the significant main function of thyroid gland. Thyroid hormones are synthesized and stored within the gland in numerous thyroid follicles, which are small spheres with walls composed of simple cuboidal epithelium. Each thyroid follicle is filled with the protein triglobulin to which thyroid hormones are attached. Between the follicles is a network of loose connective tissue that contains capillaries and scattered parafollicular cells or C cells, which secrete the hormone calcitonin. Thyroid hormone secretion is regulated by hormones from the hypothalamus and pituitary. The hypothalamus secretes TSH-releasing hormone, also known as TRH, which travels to the anterior pituitary and stimulates the secretion of thyroid-stimulating hormone, TSH. In turn, TSH stimulates the secretion of thyroid hormones from the thyroid gland. Small fluctuations in blood TSH levels occurs on a daily basis, with a small increase at night. Increasing blood levels of TSH increase the synthesis and release of thyroid hormones from thyroglobulin. Decreasing blood levels of TSH decrease the synthesis and release of thyroid hormones. The thyroid hormones have a negative feedback effect on the hypothalamus and pituitary gland as well, so that increasing levels of thyroid hormones inhibit the secretion of TSH releasing hormone from the hypothalamus and inhibit TSH secretion from the anterior pituitary gland. Decreasing thyroid hormone levels allow additional TSH releasing hormone and TSH to be secreted. Because of the negative feedback effect, the thyroid hormone fluctuate within a narrow concentration range in the blood. However, a loss of negative feedback will result in excess TSH. This causes the thyroid gland to enlarge, a condition called a goiter. One type of goiter develops if iodine in the diet is too low. As less thyroid hormone is synthesized and secreted, TSH releasing hormone and TSH secretion increase above normal levels and cause dramatic enlargement of the thyroid glands. Without a normal rate of thyroid hormone secretion, growth and development cannot proceed normally. A lack of thyroid hormone is called hypothyroidism. In infants, hypothyroidism can result in cretinism, characterized by mental retardation, short stature, and abnormally formed skeletal structures. In adults, the lack of thyroid hormones results in a decreased metabolic rate, sluggishness, a reduced ability to perform routine tasks, and myxedema, which is the accumulation of fluid and other molecules in the subcutaneous tissue. An elevated rate of thyroid hormone secretion, known as hyperthyroidism, causes an increased metabolic rate, extreme nervousness, and chronic fatigue. Grave disease is a type of hyperthyroidism that results when the immune system produces abnormal proteins that are similar in structure and function to TSH. Graves' disease is often accompanied by bulging of the eyes, a condition called exophthalmia. The thyroid gland requires iodine to synthesize thyroid hormone. Iodine is taken up by the thyroid follicles. One thyroid hormone called thyroxine or tetraiodothyronine contains 4 iodine atoms and is abbreviated T4. The other thyroid hormone, triiodothyronine, contains 3 iodine atoms and is abbreviated T3. If insufficient iodine is present, production and secretion of the thyroid hormone decrease. A lack of iodine in the diet results in reduced T3 and T4 synthesis. In addition to secreting thyroid hormones, the parafollicular cells of the thyroid gland secrete a hormone called calcitonin. Calcitonin is secreted if the blood concentration of calcium becomes too high and it causes calcium levels to decrease to their normal range. Calcitonin binds to membrane-bound receptors of osteoclasts and reduces the rate of calcium reabsorption from bone by inhibiting the osteoclasts. Calcitonin may prevent blood calcium levels from becoming overly elevated following a meal that contains a high concentration of calcium. Calcitonin helps prevent elevated blood calcium levels, but a lack of calcitonin secretion doesn't result in a prolonged increase in those levels. The mechanisms controlling blood calcium levels compensate for the lack of calcitonin secretion. Parathyroid glands. 4 tiny parathyroid glands are embedded in the posterior wall of the thyroid gland. The parathyroid glands secrete a hormone called parathyroid hormone, PTH, which is essential for the regulation of blood calcium levels. In fact, PTH is more important than calcitonin in regulating blood calcium levels. PTH has many effects. First, PTH binds to membrane-bound receptors of rental tubule cells, which increase active vitamin D formation. Vitamin D causes the epithelial cells of the intestine to increase calcium absorption. Second, PTH binds to receptors on osteoblasts. Substance released by the osteoblasts increase osteoclast activity and cause reabsorption of bone tissue to release calcium into the circulatory system. PTH, next, third function, PTH binds to receptors on cells of the renal tubuli and decrease the rate at which calcium is lost in the urine. And fourth function, PTH, acts on its target tissues to raise blood calcium levels to normal. Vitamin D is produced from precursors in the skin that are modified by the liver and kidneys. Ultraviolet light acting on the skin is required for the first stage of vitamin D synthesis, and the final stage of synthesis in the kidney is stimulated by PTH. Vitamin D can also be supplied in the diet. Decreasing blood calcium levels stimulate an increase in PTH secretion. For example, if too little calcium is consumed in the diet, or if a person suffers from a prolonged lack of vitamin D, blood calcium levels decrease and PTH secretion increases. The increased PTH increases the rate of bone reabsorption. Blood calcium levels can be maintained within a normal range, but prolonged reabsorption of bone results in reduced bone density, as manifested by soft, flexible bones that are easily deformed in young people and porous, fragile bones in older people. Increasing blood calcium levels cause a decrease in PTH secretion. The decreased PTH secretion leads to reduced blood calcium levels. In addition, increasing blood calcium levels stimulate calcitonin secretion, which also causes blood calcium levels to decline. An abnormally high rate of PTH secretion is called hyperparathyroidism. One cause is a tumor in a parathyroid gland. The elevated blood levels of PTH increase bone reabsorption and elevate blood calcium levels. As a result, bones can become soft, deformed, and easily fractured. In addition, the elevated blood calcium levels make nerve and muscle cells less excitable, resulting in fatigue and muscle weakness. The excess calcium can be deposited in soft tissues of the body, causing inflammation. In addition, kidney stones can result. An abnormally low rate of PTH secretion, called hypoparathyroidism, can result from injury to or the surgical removal of the thyroid and parathyroid glands. The low blood levels of PTH lead to reductions in the rate of bone reabsorption and the formation of vitamin D. As a result, blood calcium levels decrease. In response to low blood calcium levels, nerves and muscles become excitable and produce spontaneous action potentials that cause frequent muscle cramps or tetanus. Severe tetanus can affect the respiratory muscles, breathing stops, resulting, unfortunately, in death. Alright guys, that's it. Please put your comments on the comment section, give me your likes, subscribe to my channel. Bye bye, see you.